through my observations of you, if that's okay. So let's start first of all with volume.
Yep.
We all lose volume from our faces as we age. And there's 3 areas on you that I would consider replacing volume just to kind of lift and refresh the face. So the first area in the upper part of the face is your temples. So your temples have just gone a little bit shallow in there, and I can see in youth when you would have had more fat in there, it would have just lifted the eye a bit more.
And I think my eyebrows dropping on my bone is more prominent here. Literally, I'm feeling.
Exactly, you can feel it?
Yeah.
That's exactly what I can see too.
Okay.
And that is all to do with fat pads in the temples that, you know, keep the eyes open and wide and supported, that as they deplete cause this drop of the tail of the brow, makes the bone more dominant.
Yeah.
I mean, the orbit bone itself widens as we age too, but where we're talking about the use of fillers here, I can just open that eye back up for you. Light will reflect off the temple rather than cause a shadow. And it's a very understated, very intelligent, but very youth-giving treatment.
I've really noticed the hollowing, and I think I can feel my bone more there, for sure.
So that's the first, I'm sort of working from the top down. That's the first place I'd consider filler on you.